Hello, everyone. My name is Carmen Wright, and yeah, this is like the sixth take that I had to do for this video because I just kept messing up and I can't get it right. So this is the last time, and I'm just gonna go through it and tell you what I learned. So I picked the policy on the Obamacare slash the Affordable Care Act. And recently, with media, as everyone knows, that Donald Trump was trying to get rid of it, like be done with Obamacare, because he wanted his own. He wanted his own thing. So of course, it didn't work out for him as he wanted to. So the Obamacare is, still up and running and it's still going. Me personally, I didn't know much about healthcare insurance like I should at this age, but as I read and I looked up certain things about Obamacare and other healthcare policies and stuff like that, I was able to get a lot of information. But with this one, this is like the most current and recent one that just everybody has an uproar about it. So, the Obamacare is a U.S. healthcare reform law that expands and improves access to care and curbs spending through regulations and taxes. The Affordable Care Act main focus is on providing more Americans with access to affordable health insurance, improving the quality of health care and also health care insurance as well, regulating the health insurance industry and reducing healthcare spending within the United States. Um, Obamacare slash the Affordable Care Act is an official name. Well, Obamacare is the official name, unofficial name for the Patient Protection and the Affordable Care Act. It is a health reform law that was signed on March 23rd, 2010 by our former president, Barack Obama. Um, what does this policy do? This policy offers Americans some new benefits, rights, and protections in regard to their health care. And it's also expanding Medicaid to adults in states that embrace the program as well. It's also improving Medicare for seniors, and also it's improving Medicare for those who have like a long-term disability. Um, and it's also expanding employer coverage for like a million of employers. And I'll get to that because it's going to be talking about like pros and like the strengths and the weaknesses. I was reading an article and it said that under many Americans making under 400% of the federal poverty level will qualify for cost assistance subsidized through the marketplace. Cost assistance comes in three forms. The three forms are premium tax credit, cost and sharing reduction, and Medicaid. Something interesting that I found out was back in 2013, about 44 million Americans went without health insurance. The majority of uninsured people were working families and those who simply just couldn't afford health insurance. The major priority for Obamacare was for individuals like them to get insurance by expanding Medicaid eligibility, and offering assistance through health insurance marketplaces. Also by the like 4 years after it was going in, like everything was going through. In 2014, less than 13% of Americans were uninsured. In 2015, that rate had fallen below 10%, and they said that was the lowest it has ever fallen in history. So Barack Obama was doing something, and everybody liked it. Republicans, Democrats, everybody, they loved it. Going on to some the strengths and the weaknesses of this policy. One of the biggest benefits of the Obamacare is that it slows the rise of healthcare costs. Um, it does this by providing insurance for millions and making preservative care free. Um, Insurance companies can no longer deny anyone coverage for pre-existing conditions. Also, children can stay on their parents' insurance until they are 26 years old. Um, Back in 2012, more than 3 million uninsured people were added to insurance. So it's a lot of kids like in their 20s that it may have been a cutoff, maybe like 2023 or something like that, but they got back on their parents' insurance and they can be on it till like 26. So yeah, I got a while. I got 3 more years till I can stay on my parents' insurance. Also, businesses with more than 50 employers must offer health insurance, and they will receive tax credit to help them with the cost. So let's say Alabama A&M has to give all their employees from the janitors on up health insurance, and they're getting tax credit to help them like providing the cost for it. So I know my father, he's on Alabama A&M's health insurance as well. So I learned that like when I first got up here. Going into the weaknesses of the policy, many people have higher premiums now. Another one was taxes are going up as a result of the Affordable Care Act. Businesses are cutting employees' hours to avoid giving their employees insurance. They can't afford to pay them, like, give them health insurance, so it's hurting their business because the more people that they have, the more they gotta give them insurance. So it's hurting them and it's hurting their business. Moving along. How can social workers promote those changes? I personally believe like community resource planning and coordination like that could help promote it to get them aware of what's going on with insurance and everything. Connecting patients with specialists and other healthcare providers, like you can always give them different options, and then have that. You can always give them different options, but still have another option for them to choose from, just in case they may not want the Obamacare or anything else. Helping them understand like the conditions, and also have crisis intervention, counseling for emotional adjustment, lifestyle changes. That can affect like anybody. Like, so you can always have like counseling and just to help them get adjusted to those lifestyle changes. And maybe for illegal immigrants, you can also have assistance with illegal issues, transportations, or applications for financial aid. Those are some of the things that could, help promote the changes that are going through. Recommendations for policy change. I don't know. I just feel like you should always keep it to where you care about your people. If you're a leader of the United States, you should always care about those who are less fortunate than others. I'm the type person who will always look out for somebody in need before I can make sure that I'm okay. So if I was the leader, I would always keep Obamacare. I wouldn't change it because it has made such a positive impact over the years, over the past 8, 9 years that President Obama was, well, over the 8 years that President Obama was in office, and this past year that he has stepped out of office. So yeah, I've learned a lot, and I hope what I've told you all, helped you in some way as well. Um, so hopefully Obamacare or the Affordable Care Act will stay intact forever. And if they find something better, then they will find something better. But other than that, this is the end of my video. I hope you all enjoy it. Give me good feedback. Let me know if I missed anything. We're helping each other learn. Like I said, this was new to me. So yeah.